Hi, my name is Greta Dudley. I'm the Director of Clinical Services for Outpatient Infusion Systems. I want to talk to you today about the chemotherapy that you'll be taking at home, the pump, and some of the things that we will provide for you to support you while you're at home taking this treatment. One thing you'll want to look at before you leave the clinic with your pump is the battery compartment. This back of your pump and the door just slides away from you to open up the battery compartment. We will provide you with extra batteries, and the clinic puts brand new batteries in prior to you leaving the clinic with your treatment. However, sometimes things happen and you need to have extra batteries. Please ask your nurse to let you see this part of the pump and practice opening this door. It's much easier to do this when the pump is not alarming and you're in a more comfortable environment in your clinic than at home if the pump happens to be alarming. When you call, the nurse will ask you for several key pieces of information so that she can help best give you the answer for how to solve the problem with your pump. First, she'll need to know the name of your doctor and the practice that you see the physician. We'll also need to know the type of pump that you're using. This pump happens to be a CADD Legacy Plus. You'll find that at the bottom of the front panel. Most pumps will have that same information readily available on the front of the pump. Now that you've had a chance to see the pump, you're probably wondering what more is there to know about this whole infusion and going home with chemotherapy. Not to worry, we've thought of everything. Your nurse will provide you with a patient guide. Inside the guide are specific tools and a chemotherapy spill kit just in case you have a problem while you're at home. Not to worry, most patients never experience a spill at home because your nurse has taken the time to secure your needle and your line so there is no problems with leakage. But just in case there is a problem, you will have this kit. The first thing you'll want to note is the 1-800 number. That is the same number that's on the top of the pump. Both numbers reach our nurses 24 hours, 7 days a week. Let me draw your attention to one more piece of information inside the patient guide. It is troubleshooting alarms. We have listed some of the most common alarms that occur with your specific pump so that you will have the information readily available when you're talking to our nurse about how to solve any alarms on the pump. You're probably wondering, is this pump really going to alarm? Is it going to wake me up in the middle of the night? Am I going to have to really watch this to try to see if it's alarming? Well, let me reassure you, most patients complete all of their treatments with no interruptions and no alarms. We just like to give you all the information just in case there is a situation when the battery becomes low or maybe your tubing gets cramped inside the bag and you get a high pressure alarm. We don't want you to be scared or afraid and think something is really wrong. Most likely it's very simple and we'll be able to help you if you'll just call the 1-800 number. Thanks.